what kinds of materials, or specifically, what do you do that would be different? In other words, what materials would a typical dentist use that you don't use, for example?
Yeah, there's still a lot of metal being used in dentistry, whether you're talking about fillings that you're doing or crowns, amongst other things, teeth replacements, bridges, and partials. But there's a lot of focus on metals as an issue. Should you use them? Should you not use them?
Right.
The difference now versus in the past is there's a lot more choice having to do with what dental materials you use. There's more dental materials available to us,
Okay.
specifically in areas like composites and porcelains.
Okay.
Yeah.
And so you don't use metal in your practice?
I do use metal.
Okay.
I don't use the silver fillings, amalgam fillings.
Right.
I use other materials for smaller, for composites and fillings.
Right.
There's sometimes when we use metal under a crown, for instance, to support the porcelain.
Right.
We do use some, like titaniums for implants, things like that. However, if a patient doesn't want any metal in their mouth, that is possible to achieve these days.
Okay. I know there is a controversy, or at least mercury is a controversial topic, right?
Yes, it is.
A lot of our readers are concerned about, I have mercury in my mouth, I want it out of my mouth, or what have you. They're worried about, in terms of people coming, I imagine you get a lot of people coming to you saying, I would like my mercury removed, right?
Correct.
And I know that out there on the internet and different health practitioners are warning about the use of mercury. It causes MS. It causes Alzheimer's. I mean, I don't know if they're saying it causes it, but at least they're making an association between mercury and a lot of different diseases. And is that why people are coming to you to have it removed? I mean, what do you do with those people?
Yeah, the reasons people come for the silver fillings, to remove them, they're either old, they're just too old, or they're interested in converting them, taking them out and putting some other restoration in there, a different material that they think is going to be safer for them.
Right.
The controversy is specifically, what are these materials, these fillings, doing to my body, to my health?
Right.
That's a little bit of a line that I can't cross because I'm not a doctor, I'm not a physician.
Right.
However, we do get a lot of patients coming to us from other offices, from physicians' offices, that are looking at those issues, specifically in terms of what metals does this person have in their body. They can do testing for that. They can test for metal levels.
Metal toxicity.
Metal toxicity, when it comes, basically.
Right.
And so they might send a patient to us to remove the silver fillings, because some of the work that they do, they cannot do. They can't move forward until those fillings are removed and replaced.
So if they're on a detoxification program, their levels of metal in their blood and so forth are really high, then their doctor says, I'm sorry, you've got to have the mercury removed, and then we can start to make progress, that kind of thing, and that's where you come in? Yeah,
they can do blood tests to test metal levels in the body. Then they do the detox treatments, whether it's nutritional products, or some of them are even called chelation, where they're doing IVs, and they're removing these metals, specifically certain IVs for certain metals like lead. Lead chelation is a big one. It's very popular. It's done a lot, and it's kind of held up over time as a valid treatment for lead issues or poisoning. So there's certain chelators that also bind and eliminate mercury, for instance, out of the body. The catch here is that you can't do that type of detox with the metal fillings in your teeth. At least it's not recommended.
Because as long as the metal's in your teeth, the vapor is still there, it'll keep feeding it into your blood, and you just won't be able to make...
Yeah, from what I've heard from the physicians themselves, is they say that it's an issue because it could actually bind or pull metal from your fillings. So it's a concern of theirs And I don't know what the research is, the current research is on that, but it's enough of a concern that they don't want to do chelation
Right.
with the no fillings in place.